Hey, hello, dear managers. This is Imran, and today we are going to learn about Murinact, which is our new product. And I'm excited to just teach you how this product is going to work. What about the technical knowledge of product we are going to discuss in this PPT. So let's start. Murinact is nothing but a phosphomycin sodium, which comes under 4 grams, and this is in clinico. So first of all, I want to congratulate everybody for this new opening. Now, coming to the overview, why we should use Murinact. You know what? Due to the bacterial infections, due to many bacterial infections, antibiotics are gaining resistance, and the resistance are multi-drug resistance or extensively drug resistance, or the lack of and due to the lack of development of new antibiotic, the older antibiotics such as polymyxins, either it may be tetracyclines or aminoglycosides, has been used to to get the efficacy while treating the patient. So due to the development of this resistance, phosphomycin has also gained an importance for both gram positive and gram negative bacteria. And you will ask me why? Because it shows an excellent activity towards gram positive and gram negative bacteria. So and also one important thing, in gram negative multi-drug resistance and extensively drug resistance bacteria, it plays a amazing role. Coming to the next slide, infection. uh, Obviously, urinary tract infections are the most common infections and the second most common infections in the community. And many people, including males, females, gynec patients, and the patient in critical care, or also the patients in the ICU, have many chances of getting these infections. And worldwide, we have around 150 million people who are getting affected with this UTI. Coming to the causative organisms, we have many organisms which can cause UTI. So the isolates which are acquired from the causative organisms are Pseudomonas aeruginosa, Enterobacter, and Serratia species, whereas for viruses they are rubella, mumps, and HIV. In fungi, we can see Candida, Histoplasma, and in protozoa, T. vaginalis and S. hematobium. Okay, so let's move on to the introduction part of Murinact. Murinact comes under with a just a minute. So introducing phosphomycin sodium powder for injection. It is a new antibiotic on the horizon for the treatment of complicated UTI, that is urinary tract infection, and lower respiratory tract infection. So Murinact. Now coming to the phosphomycin. Let us know how and where phosphomycin is discovered. So phosphomycin was discovered in 1969 in Spain. So it is a phosphonic acid derivatives derived from phosphonic acid, and it is isolated from the Streptomyces species, and is a broad spectrum bactericidal antibiotic with activity against gram positive and gram negative bacteria. Coming to the mechanism of action and pharmacology, this is very interesting, and I'm going to show you with a diagram. Okay, so coming to the mechanism of action, let me give you a clear explanation of this by showing image. So here it is. This is the structure of cell wall. You can see a cell. Okay, inner membrane of the cell. This is peptidoglycan. Okay, the cell wall. When phosphomycin enters, by two transport system. These are the two transport system. When you are seeing the actual cell, this is the actual cell, right? When phosphomycin is going inside, it goes by two transport system. These are the two transport system. One is here we can find it out. L alpha glycerophosphate transport system and hexose phosphate system. So here we can see it clearly, glycerol phosphate system and hexose phosphate system. So by these two system, the phosphomycin will enters into the cell. After entering into the cell, it will directly inhibit the enzymes. So these are the enzymes: PEP, phosphoenol pyruvate and N-acetyl glucosamine MURA, which ultimately blocks the N-acetyl murmuric acid formation and N-acetyl glucosamine formation. So this is important for the formation of peptidoglycan. See here, it is inhibiting. The cross mark shows that it is inhibiting the formation of peptidoglycan. And as you see here, peptidoglycan here, this precursor is responsible for the formation of total cell wall, that is peptidoglycan. So it is inhibiting here, and hence the peptidoglycan won't build up, and this results in a cell death. Okay, clear? This is the mechanism of action. Let's move on to the spectrum of activity. As I told you, gram positive and gram negative microorganisms. Now the name of organisms are Enterococcus facialis, Staphylococcus saprophyticus are the gram positive organisms which can be treated by using phosphomycin, and gram negative bacteria are E. coli, which are the common bacteria or microorganisms, I must say, which is causing UTI, complicated and non-complicated UTI. And then Klebsiella pneumonia we have Proteus, we have Pseudomonas aeruginosa. Coming to the pharmacokinetic property, so we have half-life of drug, and the drug half-life is 5.7 hours. Then plasma protein binding is it is well distributed and well binding is nothing but getting attached, okay, or just transporting to the tissue. It reaches the eyes, it reaches the lungs, bile and wound secretion, so everything. And one more important thing, it also reaches the brain for treatment of meningitis. So high concentration can be used to treat meningitis, okay, because it reaches the brain. Elimination route is primarily through renal, because this drug is hydrophilic, means water loving, and the elimination takes place by the glomerular filtration which is present in the nephron kidney. Okay, so 80 to 19% of the drug is eliminated through the kidney. Coming to the indication, we have complicated urinary tract infection, LRTI, that is lower respiratory tract infection. And apart from this infection, it is also used to treat treat infections such as bacterial meningitis and septicemia and nosocomial infections also. But we are targeting these two indications. Then unique feature of phosphomycin. So what is the unique feature? What is the USP, that is unique selling proposition or unique selling point of phosphomycin? Let us see here. So it has high susceptibility against E. coli and lower rate after long-term usage. It has lower resistance rate and highly susceptibility. Efficacy and safety is also seen, and better patient compliance is also seen. So these are the unique features to promote phosphomycin. Okay, now coming to, okay, this is about the technical, everything is covered. Coming to the dosage. So here you can clearly see the indication and dosage. So indication can be also used for osteomyelitis in a dosage of 12 to 24 grams, that is in divided 2 to 3 divided doses. Okay, so 12 to 24 grams in 2 to 3 divided doses. For complicated urinary tract infection, it is used for 12 to 16 grams in 2 to 3 divided doses. For nosocomial lower respiratory tract infection, it is 12 to 24 grams in 2 to 3 divided doses, and bacterial meningitis also 16 to 24 grams in 3 to 4 divided doses. Now, what is the place in therapy? So as I told you, as we discussed about this MDR and XDR, so the main focus would be on the MDR and XDR infection, that is multi-drug resistant and extensively drug resistance infections. Okay, yeah, these are the some indications which I want to show you. Complicated urinary tract infection, uncomplicated, then osteomyelitis, septicemia, bacterial meningitis. I already mentioned this. Coming to the recommended dose, in normal renal function, adults dose would be 4 grams every 6 to 8 hours, and pediatric dose is 200 to 400 mg. Coming to the administration, it should be administered for duration of 1 hour. Just take this as a note. So it is IV drip of phosphomycin should be administered for the duration of 1 hour, and with less than 1 hour will cause some release of histamine, and histamine will cause some type of infections and all. So the dosage should be histamine is a autocoid which is normally released from the body, and it will cause some type of uncomfortability and some and irritability. Okay, so compatibility, it is compatible for water for injection, and for 5%, 10%, 30%, and 50% of dextrose and sodium lactate.